I'm Shelby Brantley, plastic surgeon in Flowood, Mississippi at Body and Face Plastic Surgery. Today, the subject matter is mummy makeover. Mummy makeover is a term that's used loosely, and it basically could be any of a hodgepodge of different operations, but the things that you primarily think about would be changing or fixing the sequelae of pregnancies, childbearing, breastfeeding, weight gain, weight loss, etc. So it usually entails something involving the breast. It could be breast augmentation, it could be a breast reduction, it could be a breast lift, or a breast lift with implants. And then the second thing you would think about would be the abdomen. The abdomen obviously can be ravaged with pregnancies. Having large babies, substantial weight gain associated with the pregnancy can separate the rectus muscles, which run off of the bottom of your rib cage to your pubic bone. And even with core strengthening exercise, sit-ups and the likes of that, you're not able to bring the muscles back together in the midline. And the analogy I would make there would be, if you imagine that somebody pulled on your panties to the point where they broke the elastic in them, it wouldn't matter if you put them in the dryer for an hour or a day, they still would fall down. The only way that you could remedy that would be to take a pleat in. So essentially what you're doing is you're pulling the muscles back together in the form of a corset or an internal corset, such that your abdomen is flat in the front, and then from the profile view that you don't look protuberant as if you were still pregnant. And then often that's combined with liposuction, and liposuction is basically a treatment that's used to address fat that's refractory to diet and exercise. Liposuction shouldn't be construed as a weight loss option. It's more of what I'd call a shaping operation, or if you have small areas that doesn't matter how thin you get or how much dieting you do, they're still there. So we can take those down and give you a better contour. Or it might be associated with, say, tightening loose skin on the back of the arms, or tightening loose skin in the medial thigh regions. But basically it's a combination of several procedures done simultaneously. And you go, well, what is the capitated amount that can be done in a single setting? That would be predicated not on the duration of the operation, but instead on things like third spacing, blood loss, areas of dissection, and the likes of that. So I don't really have a capitated number of hours that I would operate on someone, but I wouldn't want a person to require a transfusion or hospitalization or feel like that they were really knocked way, way down with a single operation. In that situation, what we would do would be, we would be more likely to do it in a serial fashion, and that is to say, we may tackle 3 problems at one operation, wait 6 to 8 weeks or until the patient felt well enough, and then go back and complete the other 3 procedures that the patient wanted. All of that basically is a mummy makeover in a nutshell. And if you have any questions, you're welcome to reach out to my office, and we'd be glad to answer any questions you have as to your candidacy for mummy makeover.